Okay.
We are live. Hey everybody, welcome to the Optimized Influencer and Living Greater. Tonight I am joined by Dr. Jennifer Laude of Integrative Medicine of Idaho and the Hyperbaric Oxygen Therapy of Idaho. And just a little introduction, but before we do that, kind of the reason why we're here tonight is about optimization of self and health. And so I always like to open with this, that to optimize your influence is preparation to give the best of yourself in that moment to everyone you are connected to. In my opinion, that's an amazing gift that's rooted in first honoring yourself to better serve those around you. And that's one thing as I've been watching Dr. Laude over the last year or two, the last long bit, I see things popping up here and there. I'm always amazed at the insight and the inspiration and just the diversity that she offers within her practice. And so I wanted to share a couple of things just about her. First of all, just so you guys know, we are joined by somebody that she's run the rigors so that you don't have to, which is absolutely awesome. So she has a PhD in behavioral neuroscience and psychopharmacology, did her postdoc in internal medicine at Stanford with cross appointments in psychiatry and neuroscience. Professor in psychology at the department at BSU and the College of Idaho, and founder and director of Hyperbaric Oxygen Therapy of Idaho. Woo, woo, woo. And so I want to open up to something new here. I'm going to put you on the spot, but Dr. Laude, I want to ask you first off, what is something that you do on a daily basis? Probably a few things, but what's something you do on a daily basis to optimize your influence so that when you get in there, you're giving the best to everybody around you? And
yeah. Oh man, there's quite a list. So I admittedly do biohack all day long. But my optimal morning truly does start with hyperbaric oxygen therapy. So I actually have a personal unit in my home. I've got a big one in clinic here that looks a little exactly like that. And mine's almost half the size, but I try to get in there for 30 minutes just to increase my O2 levels. And cool thing about hyperbarics is it increases it in both the lymph, the CSF, and also the blood plasma. So it's different than just putting oxygen on your face, just on land here. So doing that activates my parasympathetic and puts me in a good mindset to focus throughout the day. So that's my number one thing. But I do so much other stuff. I do red light during hyperbarics, so it targets the treatment. So wherever I have the light, that's where the oxygen goes. But I'll leave it at hyperbarics.
That's phenomenal. Well, and you guys didn't get an opportunity to hear the pre-ramble. Yeah, maybe I kept it out. I should record those. I always have it stopped. I should record those, and then we could do a best of.
Yeah, they're good stuff right there.
But we were both joking about it because, of course, I absolutely love this stuff and I'm fascinated by it and I'm drawn to it. Obviously, this is your life. This is what you do. This is how you help people. This is how you help yourself. And I'm looking at the list, and I'm like, yeah, love that. Oh, not sure what that is, but I've heard about it. Oh, yeah, this is something I want to learn more of. And just going on down, we're like, we could be here for 5 hours.
Right.
We're not. We're going to try and focus in more on this idea of hyperbarics tonight. So as I'm working my mind around it, it's funny because when I first saw it, I was bouncing between the words hyperbaric and hypobaric. And then I'm like, these two totally different things because, hyper more, right? Hypo less. And I'm starting to break it down, geeking out on it a little bit. But what's behind it? Like, just so that people can understand a little bit more about how we're getting that or how you're getting that oxygen into people's bodies
right.
and out their system.
Right. Good question. So hypobarics, right, is training in reduced states of oxygen. So, for example, training at altitude, that's actually a form of hypobaric oxygen therapy. As you increase in altitude, the atmospheric pressure is reduced. And so you actually don't get as much oxygen, not only in your red blood cells, but everywhere. So overall, oxygen saturation is reduced at high altitude. So with hyperbarics, it's the exact opposite. So we're increasing atmospheric pressure. So right now on land, depending on where you live, we're at about 1 atmosphere. And so that means it's the weight of the air on us. Okay, so when we go into a hyperbaric chamber, we increase the atmospheric pressure to between 1.3 and depending on, if you're a diver and you have the bends, 6 atmospheres, which is like, whoa, a lot. In treatment, the people I see, we never exceed 3 atmospheres. So, and the therapies that I use soft shell chambers. And so that's the one that's down here. So, and it's soft shell, right? Because when you poke it, it gives, okay? So it's like actually soft, yeah. And so the difference between, I think it's critical to understand the difference between hyperbarics and what happens in your body versus putting an oxygen mask on your face, okay? Yeah. So,
really quick, that's something that we see often I'm thinking of some sports examples. That's where I had heard of hypobarics and maybe.
Yeah.
But we see people like on the football field, we see football players and they run, they sprint, and then they're all on the sides.
Yeah.
Kids are like, God, I need an oxygen mask. I'm like, I don't know.
Right. Right. So, okay. Unfortunately, my pulse ox, the battery is dead. But this little guy, this little thing here, you put this on and it takes your pulse and it gets your oxygen saturation. So this measures the oxygen in your red blood cells. Okay. So, so the hemoglobin transport, all of that, your circulatory system, that's this guy. So when you put an oxygen mask on your face, if you're at, let's say, 98% oxygen, your oxygen can increase in the red blood cells up to 100, okay? When you do hyperbarics, not only does it increase this number, it increases oxygen in fluids that don't normally have it. So, for example, as you increase atmospheric pressure, the oxygen dissolves, like I said, into lymph, into plasma, which normally is very, very low in oxygen. And even CSF, so cerebral spinal fluid, the stuff that runs up here.
Yeah.
And once the oxygen's in those fluids, it can actually diffuse into tissue. And so it can reach areas of hypoxia that your red blood cells can't normally go. So as an example, I have my little, you see that? So this is the blood, and there's a vessel there. So this yellow stuff is plasma, and then this is the red blood cell. So in hyperbarics, oxygen goes in here, and what it does is it diffuses into tissue where it normally can't go. And with repeated treatments, what happens that's really cool is angiogenesis. So hyperbarics is not about just one session, right? I mean, if you're an athlete, that could be useful. But if you repeatedly do hyperbarics, it forms new blood vessels right here. Right. So then red blood cells can go into those areas. But this is why it's so good for people that have strokes, people with Alzheimer's, or really just any state of inflammation where we can't get oxygen to those areas. We bypass the circulatory system and use other systems to oxygenate that area. So
that's fascinating. And for people that don't know that fancy word that came out there, angiogenesis is just the formation of blood vessels, right? No, that's great. Yeah. I mean, this is the language that you speak. It's beautiful. So
right. And like I happen to have a couple little handouts on hand. So we mentioned angiogenesis, right? Well, this is neurogenesis. So this is a SPECT scan of someone before hyperbarics. It's a traumatic brain injury. Okay. So holes are bad. That's all you need to know. Okay. More holes equals less cerebral blood flow. Yeah. And this is after 40 sessions of hyperbarics.
Okay.
So what does that look like to you? What happened?
It looks like stuff grew. It looks like a great, beautiful ice cream cone.
Yeah, so Swiss cheese and then not, right? Yeah. So this is neurogenesis. This is reestablishing cerebral blood flow to the brain.
That's amazing. That's amazing. Yeah. Do you see traumatic brain injury, concussions, whether they're sports related or just in life, they affect so many people, and it seems to me. And I'm a teacher by day. I see a lot of people. I have students and they're still in athletics, and I see this all the time. Do you feel like there are there's a bunch of questions, more TBIs going on right now? And is there, I don't know, maybe you've got some ideas on why, but also how can this help? Like, does this help people that have traumatic brain injury?
Oh,
I know
yes.
my wife had a concussion. It was amazing and it was frustrating. I know how frustrating it was for her and it was heartbreaking. But from the other side, like looking at her, I can't tell what she's going through, except
Yeah.
that she's not herself. And
Well, and those smart people like Nikki, it's harder to tell. I mean, and so you. Uh-oh.
Gotcha. I got you. We're back. We're back.
Oh, okay. Yeah. So I'll give you an example. Oh, my internet connection's unstable. Hopefully you can cut this out. But I recently treated a guy who had a traumatic brain injury, and it was a very, very severe injury. And it was 14 years ago. So he was in a motorcycle accident and was in a coma and it was not doctor induced, for 2 weeks.
Mm-hmm.
And just hadn't been the same since. And he did hyperbarics, and he also did neurofeedback with Katie Packwood. And we recently just got the QEEG back, so basically looking at his electrical activity in his brain.
Uh-huh.
Oh my gosh, it's just night and day, the difference between the pre and the post map. So functionally what happened is we were able to reestablish blood flow to different parts of his brain. And despite the accident being 14 years ago, we still saw improvement in function. So, I mean, for me personally, I'm most excited about what hyperbarics can do for TBI, so traumatic brain injury. The research is pretty solid.
Yeah.
And I think it's criminal, honestly, that it's not on the FDA approved list. We're working on it. There are 4 states where it is FDA approved for TBI,
Okay.
but we probably don't want to get into why that is the way it is, but
I'm fine. So,
let's keep it positive.
That sounds good. No, and yeah, we could go a lot of different rounds there, and
yeah, but it is so powerful for TBI specifically, and so veterans are using it. So traumatic brain injury is seen often in vets, and that's because TBI can be blast induced. So just the sound from IEDs or things going off can cause the brain to smack against the skull and cause an injury. Yeah, so we're seeing a lot of that. Guys coming back from Afghanistan with it.
Yeah. Does that, we hear a lot about post-traumatic stress syndrome or PTSD. Does that, is the research pointing to that being more along the lines of a traumatic brain injury or and something that might be able to be helped through this? Or are they still kind of viewed as 2 separate things and there may be some overlap, but...
All of the above is true. So people with traumatic brain injury often meet criteria for PTSD, not always, but oftentimes that's the case. But PTSD is another thing that hyperbarics is used for as well. And in fact, SPECT scans show that you can differentiate between TBI and PTSD and their co-occurrence. So, but it's very difficult to just capture, exactly what's going on by self-report. Oftentimes, we do have to do a brain scan. It's interesting because, in psychiatry, you'd think that we would look at the organ that we're studying, right, the brain, and so often we don't, but that's another side. I teach holistic psychiatry as well, and it's kind of one of my pet peeves, like, can't we, in cardiology, we look at the heart, why don't we look at the brain in psychiatry?
So instead, what are we using to analyze in psychiatry if we're not
self-report, which has a lot of problems, but people like myself and Dr. Harmon and Katie Packwood, we do EEGs. We look at the brain and see what's going on. And it's important to not just rely on what the physiological activity says. You do need to account for self-report as well. Yeah. And oftentimes there's a dissociation, but that's of interest. So
yeah. No, I think it's fascinating. I think we talked a little bit a while back, just through Messenger and stuff, but about the idea of DNA and genetics and just all of these things, and the fact that somebody could take a DNA test and it gives a blueprint. At least these are my words. Gives a blueprint, but it doesn't mean that that's the hard and fast you do this, 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 and this, you're going to turn out like this. You know, there's so many different factors, and a lot of it's stuff that's intangible. And I think that's kind of what
Yeah, good segue. That makes me want to explain my logo. I know that seemingly distantly related, but so you're a kinesiology major, right?
Yes.
And masters, right? Yes. So does that look familiar to you?
It's DNA, right?
Is DNA, and then this guy it's actually Bohr's model of oxygen. So those are electrons around there.
Oh.
I mean, so Bohr is normally circular. But the question is, okay, why does she have a DNA strand in there? Well, I'm glad you asked, Arn. So hyperbarics is actually a genetic therapy. So in the first session, we see 8,100 genes associated with inflammation getting turned off. First session. So Paul Harch calls it a symphony of the genes, which I think is pretty beautiful.
It is beautiful. It's absolutely beautiful. And I'm glad you brought up your logo, because as I was digging around, I saw it. I didn't put the Bohr model together because I'm always thinking of it in circular. And now I love it even more. And I love the fact that it's oxygen.
Right.
That's wonderful. It's amazing. But with that said, what are some of the factors that are causing, because some people may not know this, that we've got all of these genes in our bodies, and that's one of the things, going back to the DNA, even though we might have a gene that could cause the expression of XYZ, things that we do in our life can influence whether that gene is expressed or not. Am I right?
Absolutely.
Or doesn't. And so you made a notion just a second ago about when people come in, these genes get turned off, that when they come in, I'm assuming, are turned on or activated, that are associated with inflammation. We live in such a world where that's like, I would say 90% of people's problems is chronic inflammation.
Yes.
What's causing us to be so inflamed?
Oh man, we need to do a series on that. But I want to give a head nod to what you're saying. So, the pathology of most diseases, the common pathology is, like you said, inflammation. And the other is hypoxia, which is lack of oxygen. And so a lot of the times I get people saying, well, what does hyperbarics not do? And it's like, well, what's common to all diseases? Now it makes sense, right? But back to your question, what causes all this inflammation? I would love for Nikki to jump on and talk about food. I mean, the food that we eat, if you think about it, a lot of what people put in their bodies, it's not even food, like think about what's on the aisles inside grocery stores. Like there's plastic, there's bread that has no nutritional value. I mean, so food's one thing. The non-organic aspect of food is another. So things like glyphosate, we're all exposed to that, which zips open our stomach lining. So we have all these autoimmune conditions. But our stomachs are open to our circulatory systems. Well, cool thing, hyperbarics can help repair that issue, repairing the stomach lining, because it's primarily a wound healing therapy. But so food, water is another big one. There's a lot of stuff in our water that people don't realize. I mean, antidepressants and lithium are in our water. Chlorine's really high in Meridian and Boise. There's copper. Another thing is people living in older homes. So mold exposure, things like that. In Southeast Boise, that's a huge problem. Mycotoxins. Yeah. What else? I mean, we're exposed to EMF, Wi-Fi all the time. And one of my pet peeves, right, phones. One of my pet peeves is that I think people have lost connection with the earth. I know that's a little bit granola, but if you think about it, I mean, rarely do people get out in the sun and let their feet touch the earth. And that can cause significant inflammation. If you would just put your feet on the earth, people, absorb those electrons. Come on.
I love it. It's so funny. Like my mind's like, ping, 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 ping.
Yeah.
I wear shoes incessantly, and part of the reason is, and I posted about this, and I think that you followed up, and so we may have to do something here. But
Yeah.
I have chronic flat feet. I've had arch issue, whatever. But I wear shoes around the house just because I know that it makes me feel better.
Yeah.
But I'm always thinking about it, and there's part of me that's like, okay, can I get like a cork shoe? Can I get something that's going to, the cork may not do it, but something that's going to ground me? I'm sure there probably is something.
Hold on. I actually have it here somewhere. Okay, I won't find it. I'll just tell you. Yes, absolutely right. It's called Cleverly, a grounding mat, and it connects to the ground, an electrical outlet. So you connect it to the ground, and the ground actually, if you trace it back, it goes to a rod that goes down to the earth, and so the mat that's attached to it is made. Have it under my feet right now, and I don't have my shoes on, and I'm just absorbing the electrons, and it's like I'm on Earth's surface. So there you go.
That grounding mat, I got that written down.
Yeah, right.
Goodness, there was and I just had it and I didn't write it down. It'll come back to me in a minute.
That's cool.
The water. I wanted that was an interesting thing that I've recently observed. So I've toyed with the idea, a little off topic here, but toyed with the idea of cold showers for some time. And
yes.
I love the concept. I understand it. I believe it. Nikki and I had traveled. We were in Europe a couple summers ago, and I'm like, I'm doing it every day we're here. It was 80 degrees outside. I was like 90. It was perfect. I get home, dry in Boise. I'm like, I can't do it. I did it a week ago. I started. I'm doing 30 days straight. But here's what I noticed, which is really funny. Not so funny, actually. And I feel like our water is pretty good out here. We're a little bit north of Boise. I think it tastes great. A little chlorine smelling it sometimes. We definitely purify it. But I noticed that when I went to cold, that first night I didn't notice the smell so much, but I noticed it when I got out. My back was a little itchy, and I was like, this is really strange because, bear with me, I don't know. I thought this is a little strange because it's supposed to be better for your skin, and I just noticed it as the cold water was coming on me. The next night when I was in there, I felt like I noticed a little bit more of a chlorine smell in the cold water. So I don't know if there's anything there. Maybe when the hot water is coming out, maybe the chlorine's off-gassing before it gets there more, and there's not as much in the water. I don't know. But I think I was curious. I don't know if there's any relevance or if you've ever heard anything like that.
But I like the cold shower idea. I'd encourage you and your listeners to check out Wim Hof.
Yes.
And the Iceman, the ice bath. I mean, just the basic neuroscience behind a cold shower is that it improves vagal tone, which, is so good for so many things.
Well, and I'm going to pass this in a little bit. I was recently talking to someone about the mammalian response when you place your face in cold water. I think 50 degrees or less Fahrenheit. And how, I think that's the vagal response, but lowers your heart rate significantly. And that's what prompted me to go with the full cold body shower. But what I want to do, and maybe you guys data on this after I'm done with this 30 days, thinking about doing just a face in the water and just seeing how that responds.
Yeah, there's no, I don't think there's scientific literature per se on that, but in theory it should work. And I've seen it posted in forums. So people, just splashing cold water on their face in the morning. Yeah.
Crazy. Something people have done for decades, right? And good for
go swim in the river, Arn,
I love it. If I had one out the door, I'd do it in a heartbeat. So back to hyperbarics so you mentioned 40 days that for some of these patients that it sounds like that might be kind of a magic number. With people, once they've started seeing some of these benefits, do they have to continue with that kind of frequency, or are they able to come back less frequently and still maintain some of those results?
That's a really good question.
Downstream.
Yeah. So it first of all, it depends on the disease. It depends on the person. And it also highly depends on what else the person is doing in the way of treatment. So as an example, I can help someone with cancer. We can reduce tumor sizes. We can increase the efficacy of vitamin C IVs. if the person is not on a solid nutrition plan, the effects of that, it's not going to hold as long.
Yeah.
And so I strongly believe in nutrition. In fact, I won't see cancer patients unless they have a nutritionist. Just as an example, someone who wanted to do hyperbarics was juicing, and these new metabolic theories of cancer talk about, cancer consuming glucose. And in his case, I was like, ooh, I don't know, let's get your blood tested. Let's see if keto might be better for you. And it turns out that he had the highest levels of glucose that this dietitian had ever seen. So then once his diet was fixed, we were able to put him on to do hyperbarics. But so as another example, I've worked with people that have Alzheimer's. And I tend to see that the effects hold for actually over a year. Technically, I've been in business for 2 years. So I've not seen some patients for a little over a year and a half, and their effects have been maintained. But that said, I will get calls from people. They're like, oh, Dr. Laude, I think I need another round of hyperbarics. I feel like I'm regressing. And I get there and we start talking, and this person supposedly has Alzheimer's, and they're just shooting the crap with me, being sarcastic. And it's like, I'm so glad that you think this is regression, and all these stories, it really does depend on the individual and what disease we're trying to halt or reverse. And then the other thing I tell people is, I certainly can't guarantee a disease reversal, but what I can guarantee is that there are physiological benefits to doing hyperbarics, even if you don't see that reversal. But the idea is that these effects are durable over time, because that would be really not only cost prohibitive, but time-wise, like that wouldn't make sense if you had to just constantly do hyperbarics all the time. So it is supposed to hold and be durable over time.
I love that term, durable. That's amazing. Now, what's the typical length of a treatment? Is there an average length? I'm sure they can go in a little bit.
Yeah, so typically it's an hour.
Okay.
And so we have to pressurize up and down. And so this all comes from diving medicine, right? Yeah. So when you do a hyperbaric session or a dive, it's actually as if you're going underwater. I mean, don't worry guys, we're not putting you underwater, but functionally it's like you're under 10 feet of seawater, okay? So as you're going down, you have to equalize the pressure in your ears. And that, honestly, depending on what's going on in your body, that can take anywhere between 2 minutes and 30 minutes. Okay. So the longer it takes to pressurize up, usually the more neuroinflammation the person has. So that's a really good indicator to me of the level of inflammation. And then once we're at pressure, we hold for usually 60 minutes, and then we come back up. So
you're able to monitor the pressure in their body. So I'm guessing you're using like a O2 sensor or something as they're going in, or
no. So with the soft shells, little legal facts here. So soft shell hyperbaric chambers, you're only allowed to go to 4 psi. It's a federal law, which is the equivalent of 1.3 ATA. And so there's no regulation on like, okay, like are we where we need to be? It's just like 4 psi. That's it. Like, and some people, 4 is actually too much. So there's a new study out by Paul Harch. Dr. Harch, he did a PET scan on an Alzheimer's patient, and he used 1.15, I believe, which is, well, we're at 1, right? So that's an increase of 0.15. He did one session, 5 days on, 2 days off, and this woman saw an increase in glucose metabolism, demonstrated by a PET scan. Yeah. So, and the benefit's been maintained for 9 months, I believe, after treatment. Woo!
Amazing. And so here's one thing that I love. I think that we get caught up, and I even posted about it really briefly today, the idea that we get caught up in so much subjective research, just casual conversation. Somebody says, I researched this, and when in fact they went to the Googles and the ads were the first thing that popped up, and then they went to the websites with the ads, and then they dig way down and there's a study way down here, and it's like, that's not interesting. And so, what you're doing is backed up by peer-reviewed research, but also what I love and what you've said over and over again is that the tests that you're doing, the treatments that you're doing, are back. Like you're measuring those over time using long-standing skills of being able to see improvement and trust improvement. That's fabulous, because now you've got a standard and a baseline that you can compare to down the road. That's
Great. Yeah, it's so we do EEG before and after, and we also do nerve express testing, which is a measure of heart rate variability. So oftentimes what we find is that chronically ill people, right, their autonomic nervous systems are like out to lunch, and their sympathetics on high. So sympathetics, like you're seeing a tiger everywhere. Oh my gosh, and there's no tiger, right? Parasympathetic is rest, digest, heal. I know you know this. I know you know this. But what Hyperbaric does is it forces people into parasympathetic. Like it's clockwork. There's no one it doesn't do this to. But we do measure that change. Like, okay, well, did we have an effect? Like clinically, you say you're better, but let's look at the numbers. And I have actually my dad has a rare autoimmune condition. He's done rounds of hyperbarics, and I have proofs in the pudding. Like if I look at his labs, his white blood cell count went up, his platelet count went up, his liver labs, his hepatic function has improved significantly. Like, yeah. So I'm big into numbers. I can't help myself, It's important.
It is important.
Yeah.
Huge.
Yeah.
Huge. Otherwise you're just throwing darts and hoping that something sticks. So
not interested in dart games. No.
Man, oh man. Time absolutely flies. And one of the things that we had talked about at the beginning is being able to revisit some of these other ideas, because there's a lot of incredible stuff that directions to go. A couple of things that came to mind as we were going through, you mentioned that you won't see somebody, specifically a cancer patient, unless they're working with a nutritionist. Is there, in your experience, we're talking about inflammation, in your experience, is there a diet or a nutrition plan that you think is the optimal diet or nutrition plan?
Oh no, he asked me that. I personally believe that one size does not fit all. However, I don't think anyone can argue that eating whole food plant-based is a bad idea. I really don't. And by the way, that doesn't mean vegan per se. It means that you're eating lots of plants. The ketogenic diet is really hot right now. I think that it's being misused in some ways, and I think that every diet can be done poorly. So for example, the ketogenic diet is great for reducing seizures. There are other benefits to it as well. But if you are replacing sugar with things like xylitol and erythritol, and you're just going crazy on that, true, it doesn't necessarily spike your glucose, but it spikes your insulin. And so if you continuously eat that, you run into insulin resistance, which people are on the ketogenic diet to reverse that in type 2. And it's like, so I love the whole food plant-based idea. I do love the idea of a ketogenic diet for some people. And I also believe in blood tests and labs to determine whether you can process that high amount of fat before jumping onto a ketogenic diet. And I do support the idea of eating organic. When possible, even though a lot of what we're eating is probably not organic, even if we buy organic, but you should try. Yeah. And then my other pet peeve, I just have to say, is that I hear a lot of people say, well, I can't buy organic, it's too expensive, therefore I'm just not eating vegetables. Okay. So there's studies that show that eating, even if it's not organic, eating that GMO food is better than eating McDonald's, right? I mean, so.
I wish that I could remember his name. It was on another podcast, and he was a physician, and it's a meatitarian diet, and so all he eats is eats. Have you heard it? Have you heard of this guy?
Yeah, and he went somewhere and lived with these people, right? Is that the guy you're talking about?
I'm not sure.
There are a bunch of them.
He eats one big meal a day, and it's a big ribeye, and I mean, like it's like everybody's like, oh yeah, this is awesome.
Oh my
And
gosh.
he said ideally, because they brought up the idea of, you can read about this pretty prevalently, that corn fed and whatnot, cattle and grain fed cattle, if I'm not mistaken, is high in or higher in our inflammatory, or in the inflammatory omegas. And grass fed beef is lower, has a better ratio. And so his point was there, if you can eat the grass fed, great. And if you can eat grass fed organic, great. But his point with what he was talking about was that if you can't do that, if you can't afford that, there's still benefit doing it this way. And of course, he was an advocate for that style of eating. And I love that you said that. I think that it's very easy to just throw stuff out the window, because we're all or none. I mean, we operate that way. It's like, if I can't do this and it can't be perfect, well, then I'm just not going to do it. And it just,
we're great at rationalizing whatever it is that we want to do, And the other thing too is it really can't be argued that refined sugars, they're horrible. They eat holes in your brain, and I mean that almost quite literally. I mean, sugar is similarly addictive as heroin.
Mm-hmm.
In fact, there are rat studies that show that it's more addictive.
So,
eat real whole food, people. Don't eat this plastic chemical crap. Like that's my diet advice.
Well, I love
and hire Nikki to cook for you.
She it's all made from scratch, and that's
intermittent fasting.
Amazing. Oh yes,
that's another good powerful tool.
When people are intermittent fasting, I've been looking lately into plant-based a little bit more, and I'm very happy. You've talked about Nikki a few times, and I'm very lucky. And the food that she makes is amazing, and her theory and philosophy behind it. Me personally, I tend to kind of eat around some of the green stuff, or just decide not to put the green stuff on my plate. It's me. It's like, I've got to make that conscious decision to do it, and I'm working on that. And so this idea of plant-based is something I've been playing with. And you're the second person recently that has said, and I love this, that has said plant-based doesn't mean vegan. And it's curious, because I just joined a Facebook group recently, and it's a plant-based Facebook group, and I'm like, sweet. And then the next day I see something come up, and they're shooting out, oh, we've got trolls in here that eat meat, and I'm like, wait a minute, I thought plant-based, and I agree with, I've looked in more, and I agree with that concept and philosophy. Am I mistaken? It's just whole foods with brains and being like you're
literally like in plant-based. Like, remember that god-awful pyramid that they devised in the 90s? Okay, it's like at the base are plants. That's your base. Yes, there can be meat in there. A lot of people who are whole food plant-based, they don't eat meat, but that's not what that means. That's not what that means.
Got it.
That's called vegan. Well, if you're, not eating meat and dairy, but it's kind of a misnomer. Well, people treat it as such, but it means exactly what you think it means.
Yeah. I love it. And on the intermittent fasting idea, because that's something else I've looked at recently. There's a lot of really neat research in there for things that I'm wanting in my life. Do you see a feeding window? 8 hours, 12 hours, 13 hours?
I have an 8 hour. That's what I do. And I do intermittent fasting and hyperbarics actually to help regulate my insulin and my glucose handling, because truth be told, a little too much erythritol during my keto stint caused some insulin resistance. And that's why I know a good amount about it. But the intermittent fasting, it has helped normalize my insulin. So I've done, a glucose tolerance test, and my curve doesn't look as flat as it used to. So between hyperbarics and intermittent fasting. So it really just helps heal your metabolism, and it gives your body a break so that it can devote its energy to healing itself, as opposed to processing food all day long, because we graze all day long, most people.
Yeah, no, we've suggested that for so long. Maybe not all of we, but enough of we that it's been
right. Yeah.
Well, that's fabulous. Well, I know you've had an incredible day, and all the biohacking in the world doesn't replace the need to chill out and just have some me time. So
Yeah.
I want to make sure and give that to you.
Can I show you one thing really quick?
Yeah.
I want to impress upon people how powerful Hyperbarics is, and then I'll stop talking. It'll be short. But look, so it's FDA approved for wound healing. Oh, I should give a warning. This is graphic, so if you're sensitive, avert your eyes. Okay. So this is a diabetic foot ulcer. This guy was scheduled for amputation. Okay. He did 26 sessions of hyperbarics in the middle here. And you can see the ulcer closing up. This is 50. So his foot completely closed up, and he was able to keep his foot. So when you think about wounds, wounds are not just those that are open flesh and right in our face. Wounds are wounds in the brain, traumatic brain injury, post-traumatic stress disorder, Crohn's, stomach inflammation. All of those things are wounds. And just remember, if anything, from this interview, that hyperbarics is a wound healing therapy. Okay, and wounds are not specific to things that we can see overtly.
Right. Yeah, some of the greatest wounds, you mentioned leaky gut, you just kind of mentioned it again, are things that we don't see and we don't realize, and it's affecting so many of us.
Exactly. Yeah.
I love, you've impressed upon me a couple of times, and this is something that I didn't realize, but one of the things that I truly believe is that as we get older, we don't have to give up on life. There is so much opportunity for living and improvement. And we can give a lot of examples, whether we're talking about individuals with Alzheimer's or people with gut issues or insulin issues or wounds, being able to help that individual, save his foot. What an increase in quality of life for that person. Imagine having to learn how to walk without a foot at 60 years old, 70 years old, 80 years old. A lot of times people, that's an in-game thing. And so I love that aspect of it, and just being able to turn the switch. And so I'm so fascinated by what you're doing. I thank you so much.
A new lease on life. That's I hear that from people often. Like, I feel like I have a new lease on life. It's just, it's pretty cool to be able to help people out with that. So
that's amazing. That's got to be rewarding.
Yeah.
Well, I am, as always, everyone, I will be posting down below links and ways to get in touch with Dr. Laude. And I know that one of the services, and you even mentioned yourself, that you have your own unit at home. So one of the things that you offer is rental, so that people can have the unit or a unit that's sufficient for them in the home, so they can do treatments there. That's a time savings effort, and probably more comfortable and everything as well.
Yeah, that's what I think. Yeah. And a lot of these protocols, truthfully, they do require up to 2 sessions a day. And I love the clinic I'm in, but for some people that's too much of a drive and too much of a time commitment. People that are really sick just can't do that, just really, really sick. And so we do the best we can to offer, the service at home, so that people actually adhere, because, if you don't adhere to the protocol, you're not going to get the healing that we're promising, or that you're expecting rather. So.
Right.
Yeah.
Well, and one more question, if I may, because I would feel remiss if I didn't ask this, but we've talked a lot about wound healing and healing disease within the body. What about the healthy individual that, and I don't want to always go to athletics, but what about, let's just say, the healthy individual that wants to perform at a higher level? Is there benefit of hyperbarics for them? You mentioned angiogenesis. I think about, an athlete, the more vascularity you have within the muscle belly, I would imagine the more oxygen you can get in, the more carbon dioxide you can get out, et cetera, and furthermore. So, is there?
Well, I'll explain in more detail, but first I must ask you, do you guys know who that is? You see him? Okay, time's up. It's LeBron James. LeBron James, okay? And he's doing hyperbarics, and he has the exact chamber that I use, just saying. But LeBron uses his chamber to recover faster from his workouts. And so it reduces lactic acid. and just generally speeds recovery. Michael Phelps has one. There was a guy toting one around at Ironman. You know, these athletes bring them to heal faster. So,
well, that unit you say toting around, it's a soft shell. So does that unit compress down in like a suitcase?
Yeah, like I have a new chamber that's out in the hallway right now, and I can actually fit the entire thing into a case you can't see my arms, but it's like about this wide, and then about like 4 feet tall. Yeah, I mean, like you could technically put it on a flight, and I bet you Lebron and Michael Phelps are doing stuff like that, or they're just having someone ship it. Like, I want another one. You know, I know Paula Abdul has one in her tour bus. And she's mostly healthy as far as I know. And she does it for prevention. And that's, I would love to see more people that are interested in hyperbarics for prevention medicine, instead of trying to reverse these chronic diseases that they end up with. Like, oh my gosh, I would jump up and down and be ecstatic. I might even give a discount for anyone that's like, I'm healthy and I just want to do this for prevention. Like, oh, yes.
You heard it there, everybody.
Yeah, you heard it here. Can't turn that off. No. But it's really popular in the athletic sphere. Like I said, for post-workout recovery. Also, it's really great for post-surgery recovery. Mm-hmm. So they're finding that people that do hyperbarics after surgery, not only do they heal faster, but the integrity of the tissue that does heal is actually stronger than if they had not done it. So it's another cool thing. Also, soft tissue repair. As an example, my mom, she was essentially scheduled for knee surgery. She tore her meniscus, and I was like, oh, Mom, fingers crossed, but can you try hyperbarics and my red light? And between the two of those, she canceled surgery. She was walking down the stairs sideways like this. And after 40 sessions, she's walking down straight, and she still is. And it's been over a year. So, yep. Pretty cool.
Gosh dang it. And you mentioned red light too. Guys, this could be like 2 hours, 3 hours. No.
Oh my God, I know.
We're gonna shut it down. Yes. We are going to come back because there's so many great things. And I thank you so much. I learned so much tonight. I mean, I did a little bit of background coming in, but I was just like, you know what? I just want to be familiar. I'm blown away. I'm really, it's fascinating. So
thank you, Art, so much for what you do and for doing these interviews. It's really great. And we, you know, in health really appreciate you. So thank you so much.
I appreciate that. Thank you so much.
Yeah.
So everybody check out down below and post any questions in the comments when this is posted up, or you can email Dr. Laude directly. And thank you so much for joining in tonight. And,
thank you. All right. Have a good night. Let's get some sleep.
Sounds good.
With some CBD. We'll talk about that as well. Okay, bye. Great.